Hopefully it's easy to see that our company is not all about the money. However, since we are a business, it is important that we take into consideration our finances and make sure that we're being efficient with our time. What does this mean for you in your role and our patients in their flow for each visit? We give the expectation to our patients that their visits will last for about an hour. Now, with the way that billing insurance works, we find that a window between 53 minutes of time to 75 minutes of time is the correct window. Because below 53 minutes, we're not able to bill enough for our services to make it worth our time with that patient. And anything above 75 minutes isn't able to be billed. So how do we track this as exercise specialists? In your role, you will start to develop the ability to feel the flow of what an hour feels like. One thing I encourage exercise specialists to do is use context clues. If a patient is being scheduled every half hour, you can expect that when a patient gets set up on heat, gets seen by a physical therapist, and completes their exercises, if they leave at 60 minutes, they should be leaving and finishing their last exercises as other patients are beginning to walk in the door. Now, that's not a perfect science. There's patients that show up a little early and get started, or show up a little late. But what I encourage you to do is pay attention to the feel of the clinic. We want to make sure that every patient gets the best care possible. But this doesn't always mean that they have to do every exercise that's written on their chart every visit. So again, this is one of those opportunities for you to realize that you can rely on the provider that day to help guide you to know which exercises to prioritize. For example, if you're working with a few patients and you notice that one has been there for about an hour, you see other patients coming in for their heat setup, and you see that they have 3 or 4 more exercises left on their flow sheet. You might consider walking over to the provider and saying something like, "Hey, I'm working with John today, and he's been here for a while, and this is what we've gotten through so far. Are you want me to finish up with what he's doing now, or is there 1 or 2 other exercises you'd want me to prioritize?" This is a great way to offer 2 suggestions to provider to help them in their ability to make the best decision for the patient that day. It also helps us keep our flow, as we don't want to feel overwhelmed with making sure that we're looking out for too many people at the same time. In fact, having people overstay their 60 minutes and especially overstay 75 minutes is often when we feel it's the hardest to keep patient flow within our clinic. It becomes the most stressful, and it tends to lead to burnout over time. So please help us be mindful of when our patients are overstaying that amount of time. If we notice that it's happening regularly, you might also suggest, "Hey, this patient tends to stay more than their hour quite a bit. Are there exercises you would want to discharge to help us better prioritize what they're doing when they're here?" That's an absolutely appropriate question for an exercise specialist to ask a provider. It is not your job to determine which exercises we skip and which we take out. Don't try to take on that pressure. But it is your role to help us recognize when we could better be prescribing exercises to make sure we're making the most of that patient's hour when they're there. Maybe they've had an exercise that they've been doing for a while that served its purpose. And we do our best to make sure that we advance these over time, but sometimes we overlook these. And having your set of eyes on it as well helps us do our job better too, to make sure that we're focusing on the most important activities that will get this patient back to where they want to be. The other way that you might recognize that somebody's staying too long is that you feel the busyness around you with too many patients in the clinic at one time. If you start to feel this busyness, feel free to even take a glance at the schedule. On the schedule, you'll see a line across that tells you what time it is currently, and you'll see how it corresponds with each patient visit. If you notice that that line's outside the hour, you can feel confident that you can have that conversation with the provider that day and say, hey, this patient seems to be over an hour. Are you okay with what they've completed right now, while showing the provider their flow sheet? Or should I have them do one or two others that you'd prioritize? And then again, at follow-up, you might say, this has happened quite a bit with this patient. Before next visit, will you prioritize which exercises you'd like them to do next time so that we can help keep the patient's flow? This is absolutely appropriate. You're not telling us how to do our job. In fact, I welcome these conversations. This makes me a better clinician, and it helps our patients have better care. We appreciate any time that you look out for us and look out for the flow of our patients. Do not feel the pressure that you have to kick them out or feel the pressure of deciding which things to cut out of their program. Lastly, if a patient asks, well, I typically do these exercises, all you have to say is, well, your provider you saw today wanted you to focus on the ones that we did so far. And they are confident that this will help in your rehab. Those are powerful statements that will help a patient feel that they are being seen and that they are having somebody who's mindful of their plan of care.